Here's your host, health and wellness correspondent, Lee Kelso.
Good morning. So great to be back with you. Thank you for taking us along wherever you are, whatever you're doing on this Saturday morning. One of the things that we do around here is try to keep you up to speed on the latest treatments and trends in healthcare, and that's certainly where we are today. I want to welcome to the microphone Dr. Jared Wegman from Indiana Direct Primary Care. Great to have you here today.
Thanks. Good morning.
So you are at the leading edge of a trend in healthcare, and that is to eliminate the barriers between the patient and the doctor, getting the insurance company out of the picture and giving you more time to have personalized care. I want to learn more about how all of that works. So tell me how your practice is different.
So it's a trend that's going across the country. You know, it's new here in Fort Wayne. And so our practice is different because we don't take insurance. We eliminate that portion of the regulation that goes along with insurance. And by doing that, we can solve some of the major problems that people have with healthcare, which is not spending enough time with the doctor, not having access to the doctor, when they need them, and being able to do things their way. So it's not something we have to go through that typical regimen, the way the insurance company makes you do it. So in some cases, when people have an injury, let's say you have to have an x-ray before you have an MRI, even though we know the x-ray is not going to do anything or not going to show us what we really need to see. So we're spending a couple $100 on a test that really doesn't mean anything. But according to the insurance company, we have to do that test first because they won't approve the MRI or the CT scan until that's done. So we eliminate those things. And that's just one example of how insurance companies run people's healthcare. And now we can do it, more efficiently.
So without the insurance in the package, in this relationship, you've got a business to run, you've got a family to raise. How do I pay you? What does that look like? What is your membership structure? I find that really interesting that you handle patients under a membership.
Yeah, so, we basically limit the number of people that can come in. So we target to a patient population of about 400 or 500 people, whereas most physicians have somewhere between 2,300 and 3,200 patients. So we give more individualized care, and by what we can do to do that is we just charge people a monthly fee. So at $99 a month, people come in, they have unlimited access to me, they have unlimited access to our gym, we have a personal trainer nutritionist, we have wholesale pharmacy, we have wholesale labs available with us, and we can do that because we limit the number or the amount of overhead that we have. We don't have a bunch of nurses, MAs, additional people. We don't have billers that we have to pay. Everything, is cash based. So we can make it more reasonable as a monthly fee because of that. We just limit everything as far as overhead. So when people come in the office, they may see our office manager sitting up front, but oftentimes they just see me. I'm there, I'm waiting for them. We go directly back to the room. They don't have to sit in the waiting room because we limit the number of patients that we see. We have more time to spend with them. They don't have to sit in the waiting room because I'm not in with 20 or patients for the day, things like that. So it really is, you pay a flat monthly fee, you get access to all that. It's completely different than what people are used to, and we realize it's a new concept here in Fort Wayne, but it's really taken off across the country because in most cases, spending $99 a month for healthcare, that's sure, it's an extra expense, but that's less than most people's cell phone bills, less than people's electric bills, all the things that they have that are basics. And everybody these days, I think we all agree, healthcare is kind of a basic thing that we need.
Oh man, especially when you get to be my age. Yeah, that's a big concern. So I want to go back to this idea of unlimited visits. So truly kind of totally unlimited, as much as I need, as often as I need?
Yeah, and what we really find is that when people sign up, they come in and we do see them more often. But when we do sit down with them those first visit, we spend more time with them. So they're able to get a lot more things out. So in that visit, by the time we're done with the visit, before we're done, the next question is there anything else? Is there anything else you want to talk about today? And oftentimes there is, and they're surprised that they can get, more time and be able to get more things out. And then they'll also sit and say, you know what, there was something, but I just can't remember. And I said, that's okay. You know what, if you go home and remember, you can call me, you can text me, you can email me, or you know what, you can see me tomorrow, and it doesn't cost you a dime more to do that.
It's kind of mind-blowing for people, isn't it? Kind of hard to get their heads around that.
It really is. And I think it's in some ways comforting to them because they don't feel rushed. They don't feel stressed to get everything out in that short period of time. Because when you go in the doctor's office, some people have a list of things. They're just like, I got to get through this list. And they get through the first thing, and then you start talking about it, and time gets eaten up, and then you might get through the second thing, and you've got a couple more things on the list, and by that point, the doctor's got another patient to see, so they're kind of backing out the door. It's not that they don't want to address those things, it's that they literally don't have time, because the longer they spend with you, the next person's waiting that much longer, and then it backs up through their day when you have 20 or 30 patients. When you don't have that backlog, we have the time to be able to spend with them, and so that unlimited, visits, sure, you can see me every day if you want to, but really what happens is they might see me a couple times fairly quickly, but then oftentimes that sort of filters off, and a lot of what they need and what can be handled, they can simply send me a text message. They can send me an email. We can talk on the phone. Doesn't mean you can't come in the office, but oftentimes they don't need to.
Sure, yeah, and that makes all the sense in the world. There's so many times when you just have a quick question. Hey, can I do this? Can I shift this med around? All that stuff. So give me an example, maybe think about this week, some patients that you saw and how the experience is different for them seeing you instead of the traditional doctor.
I can think of a couple. I've got a younger guy who, needs, just more time. He just needs to be able to sit and talk. So, a lot of what we do is more therapy for him. He doesn't have to see a therapist. I'm not a trained therapist by any means, but going through medicine and things like that, obviously we have some skills to be able to do that. So we literally just sit and talk for 20 minutes. And he comes in fairly regularly to do that. I have another new patient that I saw this week who's a young kid, unfortunately, who was diagnosed with stage 4 cancer. And one of his biggest issues is that he just doesn't have time to sit and talk to the doctors. He doesn't really understand all the treatment protocols, all the things that he can do. He wants to seek some alternative treatments. And a lot of the other physicians don't agree with it, and they don't hear him out, and they sort of push that stuff aside, and it's really important to him. So we can sit and talk, and we can do things and add to his care from that perspective, where he, there are other physicians in town that do that for sure, but this town is very busy in that aspect of medicine right now. Integrative medicine is huge, right. And so the few integrative doctors that we do have in Fort Wayne are very busy. So being able to add another facet to that, another clinic in town that focuses on that in addition to traditional medicine is beneficial.
And we are back with Dr. Jared Wegman from Indiana Direct Primary Care, talking about a different kind of healthcare, a membership-based healthcare relationship. Just you and your doctor. You pay a fixed monthly fee, and you have access to Dr. Wegman as often as you need, and lots of other services in the office. What else can you do for me in the office?
So we do some minor procedures and things like that as well. So we are able to do essentially anything they can do at urgent care except for when we had to provide x-rays. So if you have a broken bone or things like that, just because we don't have that available in our office. But anything that you would walk into an urgent care office, we can do there as well. So
what do I do if I need an x-ray, an MRI, or some other test?
So we partner with a radiology facility in town that does discounted pricing for that. So if you need a x-ray, there's a discounted price for that. If you need an MRI, for instance, places like the big hospital systems, oftentimes an MRI is anywhere from $4,000 to $6,000, depending on what type of MRI you're getting. At the facility we use, that MRI cost is right around $700. So it's not inexpensive. It's not something that to be written off as not a big expense, but it's not $4,000 to $6,000.
Wow. That's a huge savings.
Yeah. So one of the other things that we do for our patients in the clinic is, let's say you don't have $700 to do the MRI, but you need it. So we partner with our patients and say, what can you pay per month in addition? And we say, Indiana Direct Primary Care will cover the cost for your MRI to get it done. You pay us $100 a month for 7 months, and we'll take care of that for you.
Wow. Okay, I get it. You really are a partner in my healthcare. Got a question here that came in over text. How can a person truly take advantage of direct care when we all need insurance to help offset medical bills, especially procedures, diagnostics? Seems almost like that a fee is charged, but services are pretty limited if something else goes wrong health-wise.
Right. So I would say two things to that. Not everybody has insurance and has, direct access to insurance, because there are a lot of insurances out there for people who they just can't afford it. So for the people in that scenario, for $1,200 a year, $100 a month, which is what most people pay for their cell phone, they have access to at least primary care. And what we do is preventative care. And when we spend the time with the patients that we do, we really focus on preventative care to try to prevent them from needing the hospital, the urgent care, some of those other things. Now, going beyond that, for screening exams, colonoscopies, let's say, of course, we don't cover colonoscopies, so there are insurances out there that will do that. What we find is that there are a lot of people that have really high deductible health plans at this point, whether that be through a workplace or whether that be through the marketplace. So, they may have a deductible of $3,000, $5,000, $8,000. So when they get their primary care through us, they're spending that first initial $1,200 there. So they can do it on a monthly basis and spread that out throughout the year. And then when they need those additional tests, it still goes against their deductible. Oftentimes their colonoscopy may be covered, but other things that are then diagnostic. So your screening colonoscopy is covered under insurance, but as soon as that becomes diagnostic, as soon as that you've already had a polyp, as soon as you have a reason to have the colonoscopy, you have blood in your stool, there's something else going on, that goes to your deductible. That's not free. So, having insurance, is it helpful to have backup insurance? Absolutely, for those catastrophic events. And so what a lot of our members have is either high deductible insurance that they're forced to have anyway, or they will have a catastrophic plan that says, I'm pretty healthy, most of my care can be done at the primary care doctor's office, but just in case something does happen, I'll have catastrophic insurance that sits behind that. And so they're paying the $100 a month, they're paying a low monthly fee for the catastrophic insurance. And whereas before, with the high deductible insurance they're paying through the marketplace, I have one family that's paying $1,600 a month, has an $8,000 deductible, a $16,000 maximum out of pocket. And, so to them, they're like, we're going to back that down to catastrophic insurance. We'll pay the $100 a month for the family members, and then we'll save anywhere between $600 and $800 a month, and not paying the $1,400. We'll put that in a health savings account. We'll put that something else. So when we do need it, if something catastrophic does happen, we have a savings account sitting there waiting for us to be able to use that. And of course, everybody hopes you don't have to use that. And odds are you probably won't. But if you do, it's there.
Specialist care has become such a big part of medicine these days. Do I always need to see a specialist?
So I would say the answer to that is no. I think that people think the specialists, they need to go see a specialist for certain things, and there's nothing wrong with that. But what I would say is that once you do see that specialist, a lot of what can be done can be followed by your primary care doctor. I think what happens is a lot of people have multiple medical problems, and when you go to your primary care doctor's office and they have 15 minutes to spend with you, it's really hard to dive into your heart issues, your diabetes, those other things. So they really focus on more acute issues or something very simple. They don't have time to go through everything. So they parse some of that out to the specialist's office for follow-ups and things. That can really be done at the primary care doctor's office. You may not need to go see the specialist at all, or you may need to see the specialist once a year instead of 4 times a year. And I think the specialists would, in general, agree with that. Their offices are bursting at the seams with things that are fairly simple for medication refills, for things that don't necessarily have to be done in their offices. They could be done at the primary care doctor's office, but everybody realizes that everybody's busy, and so we just kind of have to parse out and do the best we can. Whereas in our office, we can spend more time with patients. We have that ability to go through, all 5 chronic medical conditions in pretty good detail.
It is such a shift in thinking about healthcare. It's really pretty remarkable. And if you have a question for Dr. Wegman, we've got just a few minutes left in this half hour. So jump on the phone and get your call into 447-1190 or shoot that text to 46862 before he slips away today. Tell me about if I'm running a business and I cannot provide, I just can't afford healthcare for my employees. What's the fit there? How does that work out?
Yeah, that's a pretty simple thing. The businesses can, just tell their employees about us, to be honest. Their employees can go out. So one of the biggest problems we have is people knowing that we exist and that it's a possibility. So that's the first thing. The second thing is the business can partner with the patients and pay part of their membership fee, whether that's half or 25% or 75% or 100%, it doesn't really matter. And then above and beyond that, the business can decide, I'll pay for part of their medicines or part of, anything that goes through there up to a certain amount. So they can limit their exposure exposure to how much they're helping if they want to, or they can pay for all of it. And obviously with the small businesses and things like that, when we get multiple members from a small business, there's a discount for that. So we can offer, a certain discount for how many employees sign up and how many people are available in that business.
It's you run the place, so you've got the flexibility to do what works. I love that whole independent entrepreneurial approach. I think that's just really great. If I need some services in the office, if I need some medications, those types of things, do you have anything like that around?
Yeah. So we, for the laboratory stuff, we literally draw the blood there. We do send it off to a lab to be done. We don't run the tests there, but we do everything at a very discounted cost. So where a blood count may be $100, $125 cash based at the hospital or at the lab itself, through us it's $7.50. So we're able to get that discount.
Wait a minute. $150 discounted down to $7.50?
Right. So, I made a post recently about this where there's, certain places in town where you can get independent labs and you can just walk in and get a lab. And so I compared the cost of, a blood count, electrolyte panel, a diabetes test, and all those things. And so every one of those tests at that independent lab are over $100. Every one of those tests at our place is less than $10.
Shocking. That's really amazing. So it occurs to me that we did not talk at all about your background and your credentials and your training. Tell me more about where you came from and how you were in traditional medicine and stepped out.
Sure. So originally from Fort Wayne, I went to IU Medical School and trained there. And this was always my dream, this kind of practice to spend time with patients and do this more traditional care. I actually, to do that, I did 2 residency programs. I did both family medicine and internal medicine because I wanted to be able to treat both kids, females who are in the reproductive age and can get pregnant, and then as well as people get older. Internal medicine really focuses on sort of chronic medical conditions as people get older, although a lot of my internal medicine colleagues didn't necessarily feel comfortable treating, women in their reproductive age because it's just not something that they really focused on. And of course, kids are not part of their, repertoire. So I did both residencies to be able to care across those lines.
And you were working in the big hospital systems?
Yeah. So I have spent my entire career, jumping out of there to big hospital systems, whether that's in the hospital, out of the hospital, in the ER, the urgent care, the clinics, things like that. I've kind of traversed all those different facets of medicine, even to a point of teaching residents at one point. To see, every aspect of care. I was a chief medical officer at a hospital at one point and got to see the other side, the bureaucracy of medicine. And that's really where my eyes opened up and really where I realized this isn't what I want to do. I don't want to be pushed along by the bureaucracy of medicine. I want to do medicine. And it finally got to a point in my career where I was able to open this clinic to be able to practice medicine the way I think it should be done. And to do that, we have to, unfortunately, get rid of the big players.
Yeah. So you are limiting it to 500 patients, right? You're going to just kind of stop and not take any more than 500. Is that correct?
That's correct. I think there's a certain number of patients that one person can manage and be able to give that personalized care to. When you get into the thousands, it's difficult to remember, everything with every patient. It's difficult to then respond to, certain needs of patients. So the expectation is that when people need something from me, that it doesn't take more than 24 hours to get back to them. Right now, my patient panel is pretty low, so it doesn't take more than an hour typically. But as we get further along, the expectation is that if I ever can't respond to somebody in 24 hours, that's a problem. I want people to know that I'm there available when they need me.
And that is Dr. Jared Wegman from Indiana Direct Primary Care. You can find them online at indianadirectprimarycare.com. Learn all about the membership program. And I would like to have you back in the future, and we'll kind of talk about some disease care, how you manage those things in your office, and kind of focus in on some conditions as we move forward. How's that?
Absolutely. Sounds great.